All right, let's dive into some of the latest recommendations on diabetes prevention and delay. We're taking a deep dive into the American Diabetes Association's 2025 Standards of Care, specifically their Diabetes Care Journal supplement. This is hot off the press, and people are always interested in staying healthier for longer. And honestly, with diabetes impacting so many lives, who isn't?
It's definitely a smart move to stay proactive, especially with conditions like these. Early intervention is key, really the name of the game. These updated standards, they're kind of like a playbook for both healthcare providers and for you, giving the latest evidence-based strategies for managing diabetes risk.
Okay, so let's jump right in. One of the first things that caught my eye was this emphasis on monitoring. They recommend checking people with prediabetes for type 2 diabetes at least annually. That seems pretty frequent to me. Is that new or just reinforcing what's already out there?
It's more of an underlining, just how crucial early detection is. See, many people with prediabetes don't even have noticeable symptoms. So without regular checkups, it can progress to full-blown type 2 diabetes before they even realize it. And by catching it early, lifestyle changes or medication can be super effective.
It's like that saying, an ounce of prevention is worth a pound of cure. And it's not just type 2, right? The guidelines also recommend monitoring folks with pre-symptomatic type 1 diabetes. What's the approach with that?
Absolutely. With type 1, monitoring focuses on how quickly the disease is progressing. So doctors will track A1C levels, which gives an average of blood sugar over time, and they might use oral glucose tolerance tests to see how your body handles sugar.
Okay, so a bit more complex than just a simple blood sugar check then.
It is, especially since the frequency of these tests is really tailored to each person. Age, the presence of certain antibodies, and of course the results of those blood sugar and A1C tests all play a role. It's not a one-size-fits-all approach.
Yeah, this is where it gets really interesting. The source highlights the Diabetes Prevention Program, or DPP. They found a 58% reduction in type 2 diabetes risk over just 3 years, just with intensive lifestyle changes. 58%, that's incredible. What did they find was most impactful?
The DPP was groundbreaking.
Yeah.
It proved how powerful lifestyle intervention can really be. They hit on three key areas: weight loss, exercise, and personalized support. It wasn't just about information, it was about giving people the tools and guidance to make lasting changes.
So what were the specifics? How much weight loss are we talking?
The target was a 7% reduction in body weight. Might not sound like a ton, but it's enough to make a huge difference in terms of diabetes risk. And they coupled that with 150 minutes of moderate intensity exercise per week. Think brisk walking, cycling, dancing, activities that get you moving but don't require you to be an athlete.
I love that they included the individual support. It's one thing to know what you should do, but another to actually do it. What did that look like in the program?
It was all about personalized guidance. Registered dietitians provided nutrition counseling, helping participants create eating plans they could actually stick with. And then certified diabetes educators offered support and strategies for behavior change. It was a team effort.
Speaking of nutrition, the source mentions a variety of eating patterns that have shown benefits: Mediterranean, intermittent fasting, low carb. Was there a clear winner, or is it more about finding what works for each person?
That's the key. There's no one magic diet. The best approach is going to be the one that fits your lifestyle, your preferences, your cultural background. And that's really where a registered dietitian can be so helpful. They can help you navigate all the options and create a sustainable plan.
It makes sense. It's about those long-term habits, not just a quick fix. Now, what really surprised me is that even if someone doesn't hit that 7% weight loss goal, 150 minutes of weekly exercise still led to a 44% risk reduction. That's incredible.
It is. It reinforces the point that every bit of effort counts. Even moderate physical activity has a significant impact on metabolic health. And it's something most people can incorporate into their lives without needing a gym membership or, fancy equipment.
Right. You don't have to become a marathon runner to reap the benefits. Now, I know we can't talk about lifestyle without mentioning sleep. How does that factor in all of this?
Well, sleep is often overlooked,
Yeah.
but it's absolutely crucial. Poor sleep is linked to insulin resistance, which can lead to type 2 diabetes. Think of it this way. When you're sleep deprived, your body is stressed. And that stress can mess with your blood sugar control.
So it's like all these lifestyle factors, nutrition, exercise, sleep, they're all interconnected pieces of the puzzle. It's not about doing one thing right, it's about creating a healthy lifestyle overall.
You got it. They all contribute to a bigger picture of metabolic health. And making positive changes in one area, it often has a ripple effect on the others. It's a win-win.
All right, so we've covered the power of lifestyle. But the source also mentions medication for preventing type 2 diabetes, specifically metformin. Is that a common strategy?
Metformin has been used safely to treat type 2 diabetes for decades. More recently, research has shown it can also be effective in preventing the disease, especially in high-risk individuals. Think folks with a higher BMI, a history of gestational diabetes, or those who struggle with lifestyle changes alone.
So it's not for everyone, but it's a tool in the toolbox for those who need that extra support.
Exactly. And like any medication, it's important to weigh the benefits and risks. The guidelines mention the potential for vitamin B12 deficiency with metformin, so regular monitoring is key.
Again, it comes back to personalized care, working with your doctor to find the best approach for your individual needs. It's like building a custom prevention plan based on your risk factors and lifestyle.
That's a great way to put it. It's not a one-size-fits-all situation.
Well, this has been eye-opening. We've learned about the importance of monitoring, the power of lifestyle changes, and even the role of medication in diabetes prevention. It seems like there's a lot we can do to take control of our health.
Absolutely. It's empowering to know that we have the tools to make a real difference.
We'll be back in a moment to dive even deeper into specific recommendations from the American Diabetes Association. Stay with us.
Welcome back. Let's unpack some more of those specific recommendations from the standards of care.
All right, I'm all ears. What else jumped out at you from the guidelines?
Well, one thing they really emphasize is the importance of connecting people at high risk of type 2 diabetes with intensive lifestyle change programs.
Like the diabetes prevention program we talked about earlier.
Exactly.
That makes sense. But how do they envision that actually happening?
They suggest referrals from healthcare providers, public awareness campaigns, and community partnerships to get the word out. Remember, the DPP was incredibly effective.
Oh.
But people need to know about these programs and have access to them.
Access is key. But those programs aren't free, are they?
That's a critical point. The guidelines actually call for these programs to be covered by third-party payers, like insurance companies. They argue that it's a cost-effective strategy in the long run. Preventing diabetes is far less expensive than treating its complications years down the line.
Yeah, I see their point. Plus, it seems unfair that someone's ability to prevent a serious health condition could come down to whether or not they can afford it.
Exactly. The guidelines stress that these inconsistencies in access need to be addressed. It's a call for greater equity in healthcare, ensuring that everyone have a chance to prevent diabetes, regardless of their financial situation.
Now, when it comes to nutrition specifically, they recommend prescribing eating patterns proven to be effective. I know there's no single best diet, but did they highlight any specific approaches for diabetes prevention?
They actually listed several: the Mediterranean diet, intermittent fasting, low carbohydrate, vegetarian, plant-based, and the DHA cycle were all mentioned. So, it's about finding what works best for the individual.
That's quite a range. It seems like working with a registered dietitian is more important than ever to sort of navigate all those choices.
Absolutely. Individualized nutrition counseling is essential for creating sustainable dietary changes that align with someone's preferences, their cultural background, and their health goals.
Okay, so we've got intensive lifestyle programs and individualized nutrition counseling. Anything else in the realm of support and resources?
This is where technology comes in. The guidelines also recognize the potential of technology-assisted diabetes prevention programs.
Oh, interesting. So you mean instead of having to physically go to a class, someone could access similar content and support online?
Exactly. This can be a game changer for people who face barriers to traditional programs, whether it's due to location or transportation or time constraints.
It makes those programs much more accessible. But are all online programs created equal?
That's where things get tricky. The guidelines specifically recommend choosing programs certified by the CDC's Diabetes Prevention Recognition Program. This ensures that the program meets certain quality standards and has a proven track record of success.
So look for that CDC stamp of approval. What about medication for prevention? I know we talked about metformin earlier, but did the guidelines offer any more specific recommendations on, who might benefit?
They did. They specifically recommend considering metformin for adults at high risk,
Mm-hmm.
particularly those aged 25 to 59, with a BMI of 35 or greater, higher fasting blood sugar or higher A1C levels. They also recommend it for people with a history of gestational diabetes.
So not for everyone. But there are clear criteria for when it might be appropriate. And of course, any decision to use medication should be made in consultation with a doctor.
Absolutely. And even if someone is taking metformin, regular monitoring for potential side effects is essential, like that vitamin B12 deficiency we talked about.
Now, the source also talks about preventing vascular disease and mortality. I'm curious, why is that part of the conversation about diabetes prevention?
It's all connected. Prediabetes not only increases the risk of developing type 2 diabetes, but it also puts you at a higher risk for cardiovascular disease. Things like heart attack, stroke, even circulation problems are more common.
So it's about protecting your heart health as well as preventing diabetes.
Exactly. The guidelines emphasize the importance of screening for and treating other modifiable risk factors, like high blood pressure and high cholesterol. It's a more holistic approach to prevention, recognizing that these conditions are often intertwined.
It makes you realize how much power we have to influence our health. By addressing those risk factors early on, were there any other surprising connections they highlighted?
One thing that stood out to me was the mention of statins, the cholesterol-lowering medications. They actually noted that statin therapy could slightly increase the risk of developing type 2 diabetes in people who are already at high risk.
Really? But aren't statins generally considered beneficial for heart health?
They are. And the guidelines emphasized that the cardiovascular benefits of statin therapy usually outweigh the small risk of developing diabetes. It's more about awareness and careful monitoring.
So it's another piece of the puzzle to consider when making personalized care decisions.
Right. And speaking of personalized care, the guidelines put a lot of emphasis on developing person-centered care goals.
What does that mean in practice? How do you make diabetes prevention truly personal?
It's all about tailoring the approach to the individual's specific risk factors, their preferences, and life circumstances. It's about having a conversation, not just issuing a prescription. What motivates this person? What are their barriers? What are their goals? Not just for their health, but for their life.
So it's about understanding the whole person, not just their lab results.
Exactly. And the guidelines are clear that medication, when appropriate, should be used to support those person-centered goals, not dictate them.
It's refreshing to see such a holistic and patient-centered perspective reflected in these guidelines.
I agree. It's a positive shift towards recognizing the individual at the heart of diabetes prevention.
This has been a jam-packed deep dive so far. We've covered everything from the importance of access to preventive programs to the nuanced role of medication and the interconnectedness of various health conditions.
We've certainly uncovered a lot of valuable information.
We'll be back in a moment to wrap up our deep dive with some final thoughts and a question to leave you pondering. Don't go anywhere. We're back for the final part of our deep dive into the world of diabetes prevention. We've covered a lot of ground, but honestly, this is the kind of information you could talk about for hours.
It really is fascinating. We've seen how being proactive, making even small lifestyle tweaks, and working closely with healthcare providers can dramatically shift your risk.
Absolutely. So as we wrap up, what are the key takeaways you hope our listeners are walking away with today?
I think the biggest one is this. Prediabetes and those early stages of type 1 diabetes, those are the golden opportunities for intervention. We're not powerless against this condition. We have the knowledge, the strategies, and increasingly the resources to make a real impact.
It's a message of empowerment. So even if someone's listening and thinking, okay, I'm at risk, now what? What's the first step they should take?
Honestly, knowledge is power. Getting informed about your individual risk factors is key. Talk to your doctor, get those recommended screenings, and don't be afraid to ask questions. From there, even small changes can make a big difference.
You're right. It can feel overwhelming to think about completely overhauling your life. So you're saying it doesn't have to be all or nothing.
Exactly. Think about adding an extra serving of veggies to your plate, taking the stairs instead of the elevator, finding 10 minutes for a brisk walk. These seemingly small things done consistently add up.
It's about building those healthy habits over time. And remember, it's never too late to start. Whether you're just learning about your risk or you've been living with prediabetes for a while, there's always something you can do to improve your health.
I couldn't agree more. There's this misconception that diabetes is inevitable, but the research is showing us just how much we can influence the course of this condition.
That's such an important message, and it segues perfectly into the thought I want to leave our listener with today. We've been talking about the benefits of prevention, both for individual health and the healthcare system as a whole. So the question is, knowing what we know, how can we make these preventive resources and programs more accessible to everyone?
That's the million-dollar question, isn't it? It's about advocating for policies that prioritize preventive care, making healthy food options more affordable and readily available, and creating safe, accessible spaces for physical activity.
It's bigger than just individual choices. It's about creating communities that support health. And honestly, that's something we can all contribute to. Whether it's supporting local farmers markets, advocating for parks and recreation programs, or simply encouraging healthy habits within our own families.
Beautifully said. It's a collective effort, but I'm hopeful. The more we understand about diabetes prevention, and the more we prioritize it as a society, the better equipped we'll be to tackle this challenge head on.
Well said. Thank you so much for joining me on this deep dive into diabetes prevention. We've learned about the power of personalized care, the impact of lifestyle changes, and the importance of staying informed.
It's been a pleasure.
And to our listener, remember, knowledge is power. By understanding your risks and taking those proactive steps, you're not just protecting your own health, you're contributing to a healthier future for everyone. Keep learning, keep exploring, and keep diving deep.